you pick an emergency contact? My name's Soraya. I am a board-certified family medicine physician, and I wanted to talk about picking an emergency contact. Someone who is readily available for your call at any moment's notice. Now, that's impossible. However, this needs to be someone that you consider a reliable person. An emergency contact needs to be someone who's reliable to you, will answer your call no matter what at a moment's notice. An emergency contact needs to be someone you trust. You trust them with your life. In an emergency, very often, your life may be on the line, and you need to trust that this person will have your best interest at heart when it comes to making decisions about your health. You need to make sure they know that they are your emergency contact. I have been in the hospital as a resident. I've called family members that these people or the patients deem as their emergency contact, and these people did not know or don't want the responsibility of having to make certain life or death decisions about their friend or family member. It gets pretty murky waters when I have to be trying to muddle through the list of friends and family that you have in this emergent situation to figure out who's the decision maker. It's not enough for that one person to know. Everybody else in your circle who may be affected by some kind of emergency happening in your life also needs to know who your emergency contact is. You don't have to tell them. It helps, because I've been in so many situations with patients where maybe the husband didn't know that it was cousin Beatrice down the street. Daughter didn't know that it's that stepfather that's actually the decision maker for her mom. There are so many different situations where people who are most directly affected by what's going on don't know who is the person in charge, and then people start bickering and fighting, and it makes it very hard. Your emergency contacts need to have at least a baseline understanding of what's going on with your health. I know in a lot of our cultures, we try to keep everything a secret. We don't want to talk about anything. We don't want to let other people into our business. In an emergency situation, when we need to know some very key points of information, it helps that that emergency contact knows some very key things about you. Are you taking any medications of any kind at all? Do you have any significant allergies? And what happens when you have those allergies? If they don't know what happens, that's fine, but just the fact that they know you have an allergy helps. Have you had any surgeries? Your emergency contact needs to know your feelings about resuscitative care. Resuscitative care has to do with if you end up in a situation where you're unable to breathe for yourself, your heart is not pumping blood to your brain and other organs, and us doctors have to make decisions as to how to get those things to start functioning again, if at all. It helps if your emergency contact is aware that you don't want to be resuscitated in any way, shape, or form. Or if you do,